one knows aging and technology like our next guest, Dr. Charlotte Yeh. Dr. Yeh is the Chief Medical Officer of AARP Services. In that role, she makes new technologies and health-related products available to seniors. Prior to joining the AARP in 2008, she was the Chief of the Department of Emergency Medicine at Tufts New England Medical Center, a Regional Administrator for the Center for Medicare and Medicaid Services, and a board member for the American Hospital Association. She's currently a member of the Advisory Council for the National Institute of Deafness and Other Communication Disorders. Dr. Yeh completed her undergraduate and medical degrees at Northwestern University and her medical training at the University of Washington and at UCLA. Charlotte, many thanks for joining us.
Thank you. Thanks for the kind introduction.
So Charlotte, over 50 million Americans are over the age of 65. In 15 years, the United States will have more individuals over 65 than children under the age of 18. Those are some of the facts about aging. What are some of the myths about aging?
So the surprising thing is when we think of aging, right, what do we think about? It's always about decline. You've got gray hair, you've got wrinkles, you're gonna, be immobile. And the reality is actually very, very different. And in fact, there was a CDC study that said 81% of people 65 to 74 said that their health was good to very good to even excellent. And when we studied our Medicare population, our AARP branded Medicare supplemental, over half, 56% said my health is better than other people my age. And the one that really struck me is there actually is a study published in GSA that said, if you look at, do I have limitations in my work or my daily activities? Sure enough, in your 50s, 90% say they don't. But how many of you knew that by 85 and older, 56%, over half, said I have no limitations in my daily activity with work or at home. So we forget that as we age, we have tremendous wisdom, adaptability, resiliency. We have better pattern recognition, better emotional stability. In fact, there are assets that come with aging.
Can you tell us a little bit more about some of those assets that come with aging?
Well, first of all, we are pretty adaptable. Let's look at, COVID. It has truly highlighted all the vulnerabilities with aging, right? It's the old and it's scarier than ever because we're much at higher risk for death, for morbidity and mortality. But there's a silver lining in all of this. Over 68% of 65 and older have actually tried new technology just since COVID arrived. We think that as with aging, we have nothing to do with technology. 91% of people over 50 have been using the internet for connectivity prior to COVID. 77% of 50 and older actually have smartphones. And I'll bet you didn't know that 62% of people over 70 actually have a smartphone. And more people over 70, about 1 in 2, actually have a tablet, even more than in the younger generation. And they're using it to connect with others, for email, for text, for searching for information, and yes, even learning to shop.
You also mentioned that I think 71% of Americans are on social media. What are they doing on social media? And then maybe what are people shopping for online?
So what's really fascinating is some 68% are actually using Facebook. And what to me is surprising when you look at social media, nearly 4 in 10 are using it on a daily basis. It's not just intermittently. And what they use are to shop. In these days, it's probably post-COVID, it's more in the groceries and supplies and home delivery. And as many as 20% of 60 and older are actually increasing their shopping online. And they're buying new technology. We forget that there is a marketplace in this 50 and older, and they're looking for staying connected. They're looking for living their lives to the best.
You mentioned in addition to this desire for technology that older adults also have greater adaptability. Can you talk a little bit about that?
Well, I'll just give an example. This is just my own family. My mother, who just passed away, was 91. My dad is actually turning 92 today.
Happy birthday.
And with the onset of COVID, my mother happened to be in a nursing home at that time, and my dad was home. They've been married 69 years. All he wanted to do was to talk to my mom, connect with her, because of that tremendous isolation, loneliness, separation. My dad learned to use an iPhone with a caption app and has called my mother daily. My mother, stuck in the nursing home, used her smartphone to actually follow the marketplace. She used to be an investment banker and wanted to watch the market trends as they were being affected by COVID. So even in your 90s, when you have the right simplicity, the right ease of use, and the right motivation, you can learn to use technology.
You mentioned isolation, you mentioned COVID. COVID has exacted a huge toll on older adults. Up to 40% of people, Americans who have died due to the virus, live in nursing homes. Today's Wall Street Journal has this great article and image. Hopefully that's coming up there. Isolating the elderly is bad for their health, showing this woman hugging her daughter through saran wrap. What are your thoughts?
Well, there is no question that loneliness is extraordinarily impactful to your health. We know it's a risk effect of, higher mortality rate than obesity. We know it's the equivalent of half a pack of cigarettes of smoking a day in terms of risk factor. We know that increased risk of dementia, 32% increased risk of stroke, 29% increased risk of cardiovascular. So there is no question that loneliness matters when it comes to health outcome. And even pre-COVID, about 1 in 3 older adults suffered from loneliness. However, what I also find interesting, and it gets back to, can we tap into that resiliency and experience of aging? So when you look at all the studies of increased mental distress, mental disorders that are happening as a result of COVID, this fear of being alone, and it runs anywhere, depending on the numbers that you read, 20 to 30 to 40% higher rate. If you actually look at the age breakdowns, much of that is driven by the Gen Ys, the 18 to 29-year-old. And if you look at each successive generation, by the time you get to the boomers, the amount of stress, increased stress in their life, as important as it is still less. If you look at the working boomers, some 40+% of Gen Ys are experiencing fatigue, lack of interest, burnout, and only 25-26% of boomers are expressing the same. So there is something to be said that as you age, you've been through trauma, you've been through challenges, you've learned to adapt, and if we can tap into that and improve our use of technology to make those connections, it could make it a lot better, and it's possible.
So you're saying, many media reports and common wisdom is that the elderly are more alone than younger populations, you're saying the setting of COVID is actually more loneliness in younger populations than among the elderly.
I think there's more mental distress being exhibited. I mean, what I have appreciated with COVID is it used to be loneliness, oh, that's happening to those old folks, maybe somewhat to the young folks. Now that this loneliness and social disconnection is actually cutting across generations, we are now realizing as a group, this post-traumatic stress, or this stress from experiencing of social distancing, is something that is universal no matter what your age. And what has come out of this is the creativity, more of these intergenerational, there's a number of companies that are creating intergenerational virtual connections. In my mother's nursing home, they brought in tablets and used the activity directors to teach families how to do Zoom and connect. It's not the same as touch. It's not the same as being in the room, but they have learned to adapt. There are even hospitals that recognize this separation. When you go into the hospital, you can have no friends and visitors, but they've learned to use technology to show faces, to actually have that conversation and see expressions. Again, it's not perfect, but now at least there's a universal understanding, and we are seeing more community activities, being on the balconies, clapping for one another, having birthday parties where, cars drive by, blowing whistles and making parades. So while there is more loneliness, more anxiety, more stress, we're also seeing incredible creativity and more community participation.
You mentioned technologies that are enabling intergenerational connections. Can you highlight a couple?
There's two that come to mind. One is Monami and the other is Papa. In both cases, they are using college students, again, vulnerable, lonely, the Gen Z, and pairing them with older adults for virtual connection. And it doesn't even have to be, through virtual. There is a company called Ageless Innovation that makes these Joy for All pets that are robotic dogs and cats. We have found when we've tested that it actually reduces loneliness, improves mental health, and the state of New York has purchased 1,000 or more of them that they are distributing to lonely seniors that are really isolated in the hopes of it giving them some sense of connection. So it doesn't take a whole lot.
Virtual pets.
Virtual pets.
COVID has clearly accelerated the adoption of technology in a wide range of industries. In healthcare, we've gone from less than 1% of visits being via telemedicine to up to 60% of visits being via telemedicine. That just happened in the span of weeks. What other changes is COVID accelerating related to aging?
Well, I do want to focus on the telehealth. This virtual health has just accelerated enormously. Even my parents in their 90s have learned to have virtual visits. And when an actual physical exam is not needed, they have actually appreciated it because it didn't have to travel, the 1 to 2 hours to arrange for transportation and get to the visit, the 1 or 2 hours just to get their transportation home has been a big boost. What has been nice for the providers is they're actually seeing my parents in their home. They could see all the medication pill bottles piled up on the kitchen table, disorganized, and realizing we need a better methodology for how we're going to track what medications my mother is taking. So there were real positive benefits to using that. However, we still have a ways to go, whether it's virtual health or telehealth, because we have to understand those challenges with aging. Take my father, who's got severe hearing loss, and we know that uncorrected hearing loss is associated with a high risk of dementia, high risk of depression, high risk of falls, and frankly, higher healthcare costs, over $22,000 per person for anybody with uncorrected hearing loss for 10 years or more in the 50 and older. So it's a huge impact. With all of the virtual health and voice technology, and everyone says this is the bee's knees, if you don't have captioning, they actually, they can hear the sounds, but in order to comprehend, they need to be able to see the words. And I don't understand why we don't have captioning with FaceTime. All of the providers, at my parents' clinical locations have all said, let's just do FaceTime. It's easy, we can use the phone. I said, it's great. My father can see your face, he can see your expression, but he can't comprehend if I can't get captioning. So we literally, for Zoom, et cetera, we have to jury rig a side tablet that will do real-time transcription so he can both read and hear at the same time. Think about under COVID with masks. You cannot read lips, you cannot see expressions. Think about the loss of social connection. So we have now purchased a mask for anyone who visits my dad that has a clear mouth, so you can actually see the mouth and see the expression. And again, the hospitals are learning this by supplying masks with the clear mouth or creating tablet and the ability to see the faces of their providers. Because what we've learned is people are not afraid to go to the hospital only because they're afraid of risking COVID. They're afraid of going to the hospital because of fear of dying alone. And if we don't address that social connection, we are not going to be able to rebuild, the healthcare system in the post-COVID arena.
So this mouse, is this what you're talking about? Are these like the masks that you're talking about?
Absolutely. Isn't that great? And it made such a difference. I can tell you, when I first, once COVID lightened up a little and we were allowed to travel and visit my parents, we had the standard masks, and my dad kept looking and he kept saying, explain, say that again. And when we switched to the mask, you could see his face light up because he could now understand, he could see your expression. Now that's with hearing impairment, but any of us, doesn't seeing a smile mean more than just seeing your eyes?
Yes. Wow. Outstanding. We're going to let the listeners ask questions about Dr. Charlotte Yeh in a little bit, so please have those questions coming in. One person's already commented on that she has a 96-year-old friend who's just switched from a PC to a Mac and was learning the new commands. So Susan Kimball, many thanks for sharing.
Yeah.
Let's go to independent aging. 88% of Americans want to live in their homes for as long as possible. People are concerned about going to nursing homes because of the risk of COVID. What can be done to allow people to live at home for as long as possible?
So we have to remember, and I'm all for enhancing remote monitoring, enhancing, fall detection, and making sure that people are safe at home. But you have to remember, as the older adult, and as I said, 56, over half them think they are better than other people their age. So if you're going to design for independence at home, you have to remember the joy and the beauty and the social connection that also comes with age. Who says that just because you're older, you can't laugh or play or connect? This has been the beauty of Zoom, of being able to share family stories and laugh. Who says it can't be beautiful? Why can't you have a fashion sense? ARP partnered with Allure magazine and got Allure magazine to actually ban the word anti-aging from all of its advertising and all of its articles. Because why are we anti getting old? It happens to all of us, and we're looking better than ever. But they actually did a survey, and well over 81% of boomers and about 70-some% of all women 18 and older felt that media did not represent them and who their age was. And they expected that. And well over 70%, 77% said that they wanted to see advertising representing all ages, including the older age group. And 70-some% said, and if you did so, and this is 81% of boomers, if you did so, I am more likely to buy your brand and be more loyal. So how is it that we have forgotten that you can be fashionable even if you're 80 or 85? Where is that beauty in your product line, and part of love of life?
You're basically saying we should need to reimagine aging, that aging is joyous, aging is beautiful, and aging is fashionable. I hope it gets more fashionable. I'm the least fashionable person out there. Maybe you'll help me with that. But what else are we missing? What else should we be thinking about when we reimagine aging?
We want our products to represent who we are. This is pre-COVID, and in the pre-COVID era, in a marketing survey, 4 out of 5 people 55 and older said their favorite, not just any, their favorite retail brands did not understand their wants and their needs and understand who they are. And in the post-COVID world, we know that at least 1 in 2 50 and older have actually tried new brands and new products. And the scary thing for those of you out there who have existing products, only 27% of those who have tried the new brands said that they were likely to return to their former favorite brand, that they have now been willing and are trying new products and services. And it's those who I think can represent that fun, that joy, that beauty, while providing safety, convenience, and ease of use, are the ones who are going to succeed in a marketplace where, in fact, it's the older consumer who has the money and was willing to spend the money for products and services. I just look at my parents in this, in their 90s, in this COVID era. Let's see, we have a new smartphone, we have a new tablet, we've updated their computers so that they can do Zoom, and and that's just in the last several months.
So I'm going to get to people's questions in a second. The last thing I want to touch on before we go to the questions is personal determinants of health. Many people discuss the importance of social determinants of health, such as education and environment. You like to discuss the personal determinants of health. What are they?
So I think everything we've been talking about, the loneliness, the resiliency, the adaptation, to me fall into this category of what are the personal assets that you bring to the table? If we think about the levers to change outcomes, to change the cost of care, we all point to the healthcare system. Look at the great technology. We can change any joint in the body. We're learning to treat people at home. You know, what a difference that's going to make in outcomes. We're looking at obesity and diabetes. And in recent years, we've identified, wait, they're the social determinants, the community services, education, transportation, and housing, transportation, food. These are really, really important, but they're all community resources. What is it that we can give people right now as we're waiting for the healthcare system and the social determinants and communities to come up to speed? What about resiliency? What about the ability to withstand challenges? This is why we're seeing even the oldest of old being able to adapt even under this unprecedented COVID pandemic. We've been looking at what are the things that lead to resiliency, and there are three that I'd like to raise. The 3 Ps are purpose, people, and possibilities. It turns out if you have a strong sense of purpose, you have fewer heart attacks, fewer strokes, fewer cases of dementia, better sleep, 61% fewer nights in the hospital, 32% fewer doctor visits, and early data from our Medicare supplemental population, a 12% lower per member per month healthcare cost. In fact, if you only volunteer, in a recent study, if you only volunteer 100 hours a year, about 2 hours a week, there's already evidence of improved physical activity, improved physical outcomes, improved social connections, reduced mortality. And that just comes from what gets you up in the morning.
That's better than exercise, 2 hours a week.
Yeah, it's all it takes, right? Imagine with what we just talked about on loneliness, social connection. We know in our Medicare supplemental population, about 43% have some degree of loneliness, 20% are severely lonely. And we just went through, you know, the impact on mortality, length of life. We also know, for those of you in healthcare, that in our data, loneliness was the strongest predictor of dissatisfaction with your doctors and your healthcare. Imagine, you know, with all the money that goes into pay for performance, pay for experience of care, and we are not addressing one of the single biggest factor, more than depression, more than health literacy, which is loneliness. And if that doesn't affect, you know, drive you, think about the cost of care. In our 19% of the severely lonely, they have a 20% higher per member per month healthcare cost. And a big chunk of that group of loneliness are those with hearing loss. They can't communicate. They have difficult communicating, and it represents about 2/3 of people 70 and older have clinically significant hearing loss. 51% higher risk of dementia, 42% higher risk of depression, 29% higher risk of falls, 47% more admission rate, higher admission rate, and a 2.5-day longer stay just because of the inability to communicate. How simple would it be if we made hearing devices fun, beautiful, everybody wears stuff in their ears and allows you to communicate, and there's a hearing aid manufacturer who is already producing a hearing aid that can translate 27 languages simultaneously, okay, in real time. So this is where we have tremendous opportunity to address social connections, people to surround you, people to support you, people to do things with. And the last one, which is where I believe we've fallen down more than any other space, it is that positive perception of aging, that optimism. What are the possibilities? Why at 85 can't you have a vision for tomorrow? Why at 90 can't you think about what's important and what you want to do in life? We know that people with a positive view of aging live 7.5 years longer. They're 44% more likely to fully recover from a severe disability, lower risk of dementia. And in our population, a 33% lower per member per month healthcare costs. And there's one study that estimates we could save up to $63 billion in healthcare costs just from the stress related to aging. And we just talked about allure in the marketplace and boomers saying, you don't represent me, you don't understand my wants and my needs, because I see aging very differently. And if you don't tap into that, it's poorer outcomes. And by the way, I'm going elsewhere to spend my money. So if I had my druthers, you know, think about what gets you up in the morning, a sense of purpose, who you do it with, the people. That means your possibilities for the future become endless. And that alone could change how we age and potentially reduce healthcare costs, improve affordability, and a much better life.
So the 3 personal determinants of health from Charlotte Yeh, 3 Ps, purpose, people, and possibilities. I'm going to start with some questions. We have everything from the tactical to the abstract. On the tactical, Louis Tenenbaum asked Charlotte, regarding the ability to remain at home, what can you say about home design issues and about motivation to update our homes before crises occur?
Oh my goodness, this is a huge area. We could probably spend an hour just talking about the home design. The most important thing is think about designing for all and not designing for old, right? If you put levers on your doorknob, so you know it's going to work for a 3-year-old. Maybe you don't want the 3-year-old to open the door, but it can work for a 3-year-old as well as for an 80-year-old when you start getting arthritic hands and difficulty moving. Okay, why are we not creating space for you to exercise and work out? My 92-year-old dad, who was worried about being able to lift my mom out of the chair as she got sicker, started to exercise, and he now spends an hour every day weightlifting. He's got the cutest muscles for a 92-year-old because he's weightlifting and he's got the space to actually practice walking even if he's stuck in the home. He gets out there and work. What about wider doorways, accessibility? You know, I was injured in a car accident, hit by a car a number of years ago, and I could not get into the shower because of that little 4-inch ledge. So when we fixed the bathroom, I said, we're getting rid of the ledge because I have to be able to get a wheelchair into that shower, you know. And that means your 3-year-old, 5-year-old's not going to trip on the way into the shower either. So let's think about the design, and maybe stairs isn't such a bad idea because it keeps you exercising mobile. When you think of the blue zones, people who, you know, live in hilly areas, many of the blue zones are located where you've got to walk and make it accessible.
So design for all, not designed for aging. Andy from SingFit says, hi, Charlotte. Do you have a recommendation on where to get those masks with the see-through mouth cover?
You actually can find them online. That's actually where I got them. I'm told that Amazon, Staples, all have the masks that you can purchase. And I just bought a whole stack and sent them to my parents' house. So anybody can use them.
Our friend Howard Rice, who's the CEO of Teledentist, asks, is AARP lobbying for there to be CMS coverage for dentistry and audiology?
I can't speak on the advocacy or the lobbying side because I do work on the business subsidiary of AARP, but we do know that hearing, dental care, and vision care are extremely important with aging. We are hoping that the FDA is going to come out anytime in the next several months with its regulation for over-the-counter hearing aids to make it somewhat cheaper. We know that there is increasing, not perfect, not widely expansive, but there's increasing coverage of hearing aids by health plans because they're starting to recognize the link to health and the link to the cost of care. And for dental services, absolutely. AARP recently actually held a roundtable and a summit looking for where's the innovation in dentistry to make it more accessible and affordable as we age, because frankly, if we're living into our 80s and 100, we need our teeth to last that long, because we know without it, your nutrition, your nutrition, your willingness to be social and smile at others is seriously affected.
So floss.
Wow.
David
Daily floss.
David Magwell says, what is your external innovation process? Does AARP invite startups to present their technologies? Is there a selection process or a call for ideas? Do people just contact AARP directly if they have an interesting solution?
So it's a great question. And in fact, we have a number of different ways that you can approach. One of the newer ones that has been around for the last several years is our Innovation Center. It has been started by our SVP, Andy Miller. They are actively recruiting and looking at startups, including startups to potentially invest in. They host pitch challenges throughout the year, so keep your eye out for the pitch challenges and go ahead and apply, because they are looking for better solutions for older adults. They've done it in the hearing space, mobility space, even in women's health for as we age. So I would strongly recommend that you watch out for the AARP Innovation Center. A second opportunity is we have the AARP CommunityConnections.org, which is partnering with companies for what we call mutual aid, or how do you find support during this COVID-19? Where do you find resources and help? The AARP Foundation partners with young companies. They've been testing chatbot, the use of voice technology for its reduction in loneliness. And I'm on the business side of AARP. We're always looking for innovations, and we will work with our existing partners, such as United Healthcare, that administer the AARP branded Medicare plans, looking for innovation, and can we improve your sense of resiliency, adaptation, and improve your vibrancy and vitality with aging. So if you're in that space, I'm happy to talk to you as well.
And so this is, I think, Andy Miller at AARP on the culture of innovation. So that's just one of the many resources that Charlotte highlighted for you.
And at the state level, there are a number of states that are looking at task forces for reducing disparities in care, looking for improving, working longer and more productive. So there are many avenues that you can reach out to AARP.
Thomas says, many of the technologies that you mentioned are not available to those with stressed finances, with estimates that a large proportion of the baby boomers are not financially prepared to face their retirement. What do we need to do to address the poverty epidemic that's come?
Absolutely very real. This is why we do have the AARP Foundation, and any of you innovators out there that can think about how we can improve financial security and financial stability with aging, that would be awesome. In the meantime, we do have the AARP Foundation that focuses on low income, the most vulnerable populations. And one of the programs they stood up very rapidly because of COVID is an emergency food box delivery service, where if you can sign up online and you can't have the ability, you can get a food box that can provide up to a month's worth of meals. So, and we are starting to look at, are there ways that we can help support older adults who may not have the access to broadband or to internet, et cetera, to be able to order online for them.
Jenica, comment, wow, I'll second that when you were talking about hearing loss. My dad passed away at 102 a year ago, living and caring for himself. His largest complaint was loneliness and isolation due to hearing loss. Even with hearing aids, he had difficulty hearing and was investigating cochlear implants.
Right. I can tell you it makes such a difference. My dad, who is a very proud individual, refused to have hearing aids or admit that he had hearing loss for at least a decade. It was only till my mother was locked out of the house because he couldn't hear the doorbell ring when she was locked out for 30 minutes that he finally agreed to get a hearing aid. And when he got it, for someone who was very proud, never acknowledged that he had an issue, he said, you know, I was really lonely. I was socially isolated. The rest of the family thought he had dementia because he wasn't communicating. And when he could hear, it was a total change in personality, and the socialness came back. The stories came back. As his hearing loss progressed, he actually has got a cochlear implant, which he got in his 80s. And again, has made a big difference that he can hear. But it's very, very important. It's not just the device. You want to also improve their speech comprehension, because if you don't hear, you start to lose your ability to understand speech. It makes it more complicated. And any of you who is looking for technology in the older age group, independence at home, and use voice technology of any sort, you have to add captioning, no question about it.
Closed captioning, new technologies. A couple quick questions. Stephen Farber asked, accelerated adoption of technology during COVID has been exciting. Are there any new surprising failures and challenges that you've seen?
I don't know that I would say they're new or surprises. I think it has more for me. I cannot believe we have not solved for simplicity and easy plug and play. That it is every single device that you have to learn independently. It is not commonly used, and we do not make it easy, especially if you have visual impairment, dexterity challenges, or hearing impairment. Even though my dad has figured out how to use an iPhone with the caption app, it takes 4 steps for him to actually answer the phone and get to the captioning. Whereas the rest of us pick up the phone, use slide bar or push a button, and we're instantly talking. Why isn't there captioning for FaceTime? So we are not making it simple and easy, and making it functional. And by the way, if you're going to create this independence at home, and we all talk about wanting to stay in our home, we've learned through COVID that if you stay in your home and don't go out, it is as devastating, as anything else. So if you're going to design technology, make sure it travels with you, that you can take it out of the house, that you can take a walk around the community and still feel connected and still feel safe.
Adam Cohen, our friend, picks up this theme about innovation pitches for AARP. What are the priorities that AARP wants to see innovation? Do you have a list of specific problems that you're trying to solve?
Well, we could cover a whole host of them. I would say some of the top areas would be caregiving and caregivers, because we know there aren't going to be enough caregivers, professional or otherwise. So anything that you can do to help make it simpler, easier, provide the resources, because the caregivers are already overstressed with time and their own sense of health and well-being. So caregiving would be a big area. The second, we've already talked about social isolation, which by the way is the objective. How big is your network? Loneliness is how you feel about it. They're very different constructs, but related. So anything dealing with social isolation, loneliness, and the ability to connect. It also impacts productivity with aging, multi-generational workforce. These are some of the areas that AARP has a particular interest. And throughout all of these topics, think about how you can change and actually reflect aging as it is today. Where is that joy? Where is that fun? If you only see decline and how terrible getting old is, why would you want to get old? Why would you change your behavior? But if in fact, when you turn 65 and say, I've got 10, 20 years left, and how do I make sure that I'm making the most of that life? Now you've got somebody engaged who might be willing to change behavior, might be willing to learn. So these would be areas, disrupting aging, caregiving, social isolation, connection, personal fulfillment, and fun are some of the newer topic areas. And of course, we're always about healthy living, hearing better, preventing falls. Those things continue to be important, but we need to layer on that joy of aging.
I think she said joy. Many of our other guests on Chet Talks, and she's talking about aging, joy and aging, aging, joy. Rob Sheth says, are there better, easier tests for hearing? Because many people go undiagnosed or delayed prior to it.
Yeah, well, I think the most important thing out there is, first of all, you know, it's not what you lose when you lose hearing, it's what you gain when you can hear. And we've got to flip this around, that the biggest issue with detection of hearing loss is the stigma. It's not just the cost, but the other big issue is stigma. And I know this is old data, it's back in 2011, but I'm not so sure it's changed that much. More people over 50 admit to having a colonoscopy than they do to having their hearing tested. So I think raising that awareness, the Lancet Commission on Dementia said the single, you know, about 35% of dementia is potentially avoidable. The single biggest category of avoidable dementia is hearing loss, unaddressed hearing loss. So yes, it should be hearing testing. You know, when people are in the hospital, why are we not obviously, you know, checking hearing? Why are not employers checking the hearing of their own employees as part of their wellness package? We know that if hearing loss is one of the most common reasons for leaving the workforce early, with lower productivity and poor job performance, and yet it's fixable and correctable. Hearing tests, actually, believe it or not, ARP has partnered with the NIH. NIH has created an online hearing test. If you're an ARP member, you can take that hearing test for free on the arphearingcenter.org. Just to at least get that first screening. And it's enough to me, you know, is to get it checked. Early detection can make a difference, and to start getting the hearing assistance before you lose your ability to understand speech, to comprehend, and where you lose your connection with family or friends.
Rob, many thanks for the question on hearing. Karen Upstill says, ask you, Charlotte, what kind of legislation or advocacy can AARP create or support for universal access in tech, like captioning across platforms in telehealth?
Yeah, well, believe it or not, captioning is actually universally available through the FCC. There is free captioning service for anybody who's hearing impaired. You pay actually a universal tax on your phone bill that actually supports the service. So to me, it's not that captioning is not available, but it's that no one in technology is thinking about the value. And imagine if you're young and, you know, you like to party and there's always noise and activity going on around you. Wouldn't you want the captioning so you could actually hear your friends across the table? Or, you know, or maybe we should be doing a better job at noise prevention. So ARP is actively, you know, supporting better hearing. They're also actively looking for better options and additional options to living independently at home. There will be people who are going to need congregate living, who are going to need assisted facilities, who are going to need nursing homes. And what can we do to make it safer and better so that you have your choice for how you want to live as you age?
Outstanding. Before we're going to highlight what's coming up next with Chet Talk. So as many of you know, we're pleased and proud to be partnering with the Digital Medicine Society, Jen Goldsack and Andy Corvos. They're going to have a webinar on Thursday, July 30th, next week at noon Eastern, Science as Justice, How Systemic Racism Persists in Science and Medicine and What We Can All Do About It. So please join us for July 30th, next Thursday at 12 noon for this important panel with 3 distinguished guests. And then we have 3 upcoming Chet Talks in August. August 11th, Albert Blankley, who's the Chief Operating Officer for Common Ground Health here in Rochester, New York, is going to tell you how they track COVID-19 at the community level. Then on Tuesday, August 18th, Lee Shapiro, who's the Chief Financial Officer of Livongo, does diabetes care management and one of the hottest digital health companies in the country. Their stock price has tripled, I think, or quadrupled since going public last year. And then Dr. Robert Califf, the former FDA commissioner, had to reschedule from this month to next month, and he'll be joining us on Wednesday, August 26 at 12 noon. Charlotte, in closing, you mentioned that your father, 92, is still living. Your mother, unfortunately, passed away earlier this month. Your mother was beautiful. You shared me with her obituary. Sally Yeh passed away at the age of 91. She was born in Nanjing, China, was later a refugee during Japan's occupation, attended college in the United States, was married for, get this, 69 years, and became a highly respected investment banker in a male-dominated profession. What lessons can we learn from her life?
Well, thank you for asking. It's only now, as I reflect back, all of the things I just mentioned, it turns out my mother was the embodiment. She embraced aging. And I can remember at the age of 10, and she was in her 30s, she said one day, "I cannot wait until I have white hair." And I said, "Are you kidding? Like, really?" And she goes, "Because when I get white hair, I will have respect." Because there is respect and embracing of aging, especially in the Asian culture. She could not wait. The second, and we talk a lot about, and I can see with your upcoming talk on, looking at racism and diversity and disparities, she celebrated diversity. She fought for women back in the 70s when women were getting 60 to 70% of the salary of men. When she earned her way up to a management position in banking as an immigrant woman in the 70s, early 80s, and their management meetings were held in the men's club. She had to go through the kitchen because she couldn't be seen going through the front door as a woman. So she celebrated diversity, and even when she retired and went to China to teach banking for the next 17 years, she actually retired a second time at age of 79. But even in China, she wanted to have a car because she didn't want to have a driver to take her everywhere that she needed. She went to the Beijing Department of Motor Vehicles and convinced them, because at that time, if you were over 50, you were not allowed to have a driver's license. And if you were a woman, you definitely could not have a driver's license. And she convinced them that no matter your age or your gender, if you passed the driver's test, you should get a driver's license. She did it. She got her license, was tooling around Beijing, and all of the other cities in China then followed that if you pass a driver's license, you can get one. So she definitely wanted to celebrate diversity, change, and obviously from this last story, it is never too late to learn. She was 68 when she got her driver's license in China, and that is just the beginning. And only at 79 did she finally say, "Well, I don't want to work 40, 50 hours a week anymore. Just about 20 to 30 will be plenty for me." So it is never too late to change, learn new things, have a new career. It's good for your brain, it's good for the body, and it's good for the soul.
So Sally Yeh, respect, diversity, and learning. Charlotte, it's always a joy and a pleasure to speak with you. Thank you very much for joining us on Chet Talks.
Thank you.
Until our next discussion, the Center for Health and Technology at the University of Rochester thanks you. Thank you, Charlotte.